Good morning. My name is Dr. Lauren Johnson, and I am one of the physicians here at Carolina Conceptions. And I am responsible for our third-party reproduction program.
I am Larissa Moore. I'm a third-party program coordinator, so I run the egg donor database for all of our egg donors.
So you may be asking yourself, what is egg donation? An egg donation, or using an egg donor, is essentially a process where a particular person or couple uses eggs from somebody else in order to achieve a pregnancy. And so we are literally taking eggs from someone else, in many cases someone unknown, or in some cases someone known to the person, fertilizing them with their partner sperm or donor sperm, and then placing that embryo in the patient's uterus. The likelihood of achieving a live birth with eggs from an egg donor is about 65% with a single embryo transfer. So who uses egg donors? Well, there's a lot of different reasons that people choose to use an egg donor. One main reason is that a woman may have gone through menopause already and does not have any eggs remaining to use of her own, so she'll use eggs from another person. In some cases, people use an egg donor even though they still have eggs, but they may have fewer eggs or poor quality eggs. Using an egg donor allows them to achieve a healthy pregnancy with a much higher success rate than if they were to attempt using their own eggs.
All right, you may be wondering how all of our egg donors are screened. We medically screen them. They go through genetic testing, and they also go through a psychological evaluation. All of our donors are ages 19 to 31 and are in good health. For our intended parents, you will also go through medical screening similar to our egg donors. You will have infectious disease labs done, and for the male partner, you will have genetic screening done. You will also have to have a conversation with a therapist just to make sure that you're making the right choice for you. Let's talk about how you go about choosing a donor. The first step is for you to have a consult with your doctor. Once you have your consult, your doctor will refer you to me, and I will give you access to our egg donor database where you can choose the donors that you feel are most like you, have the same characteristics as you, that you would like to use. I would then reach out to the donors, check their availability, and we will get started from there.
You may be wondering how you would even pick an egg donor. A lot of people feel like that process is overwhelming. We are here to help you with that. Medically, the most important thing is to make sure that the egg donor and the sperm source, whether that's the intended parent or the sperm donor, are a good match for each other, and we'll help you do that. Beyond that, it's a very personal choice. And so we encourage you to take some time to look through the database once you have access to it to see which donors seem the best for you. So once you've selected your egg donor, that person will go through the process of in vitro fertilization or IVF. So what that means is that donor will take injectable medications to stimulate the ovaries, and then we will remove the eggs from the body during a surgical procedure. At that point, we'll go ahead and fertilize those eggs in the lab with partner sperm or donor sperm, and then grow the embryos in the lab for about 5 days. At that point, we either take that embryo and transfer it to the patient's uterus or freeze embryos for genetic testing if that's part of the plan. So some patients wonder, what do I do if I look in our database and I don't find somebody that really speaks to me or has the characteristic that I'm looking for? The first step in that case would be to check back in a few weeks or a few months. We are continually reviewing applications and approving new donors in our database. So the list of people that you see now will certainly be different in the next few months. Additionally, another resource would be to use eggs from one of the national frozen egg banks. So there are other organizations that recruit donors in other areas of the country. They bring them in and freeze their eggs, and then those eggs are available to ship to our clinic. From there, the process of using frozen eggs is similar to the fresh, meaning that we would thaw eggs, fertilize in our lab, and grow the embryos in the lab for 5 days before then transferring to the uterus of the intended parent. A lot of people ask, what's the difference between using fresh and frozen eggs? They have both very good success rates. The most important difference is that with a lot of frozen eggs, which is what they call a batch of frozen eggs, usually that'll be just 6 eggs. That's often enough for one attempt or one embryo transfer. Most of our donors will have more than 6 eggs in a fresh cycle. which differentiates those two processes. You may be wondering how long all of this will take. It varies from patient to patient and for different donors, but in general, we expect that process to take at least 3 to 6 months to complete. We hope this information was helpful for you as you think about whether using an egg donor is right for you. If you think that may be the case, your next step would be to reach out to your doctor and schedule a consultation. We hope you have a great day. Bye.
Bye.